The new initiative at the primary care centre aims to take some of the pressure off the appointment system, the doctors and the patients themselves, by making it easier to pick up a repeat prescription if no appointment is necessary.
We're really capitalising on the system which already exists, where a patient is able to bring their final prescription into the health centre. But now, instead of that automatically generating an appointment for a GP, we will be able to actually check the patient's medical record using that request, and in many cases actually just give them a prescription without necessarily having a face-to-face with their GP. But bear in mind that issuing these prescriptions will have had the GP checking the medical record first, so it's not just a kind of a clerical process. This definitely has a clinical element to it as well.
If approved, the repeat prescription will be ready for collection in 2 to 3 days' time, but if necessary, a GP appointment will be scheduled. Patients themselves can also still request appointments, and every person on a repeat prescription will still need to be seen at least once a year.
We have this very big majority of patients who are working patients, are young patients who perhaps don't need so much medical input. They are almost certainly working, or they're busy, they're studying, they're doing other things, and they're on long-term medications which may be something like an antihistamine, perhaps the blood pressure medication that they've been on for years. A very good example would be a contraceptive pill, which doesn't need a face-to-face with a doctor every single 6 months.
Mr. Costa said the new initiative was the start of a comprehensive review of primary care services that builds on recent improvements. This new measure makes use of the electronic record system to help GPs assess who needs an appointment for a repeat prescription and who doesn't.
As you know, there are 55,000 phone calls that are logged by the PCC every month for appointments, and I've made the point before that around 450 patients who book an appointment do not show up. And of course that has very negative consequences, because people who've been calling for appointments have not been able to receive an appointment as a result of people who then do not turn up.
Well, for example, with the repeat prescriptions, we allocate 3 appointments per GP per clinic, so that's 6 appointments per GP per day. And on average, we probably have maybe 15, 16, maybe 17 GPs working every day. So that's 90 appointments per day just on repeat prescriptions on a face-to-face. So if we could even reduce that by half the number in terms of patients receiving prescriptions without seeing the GP, we've freed up 40 or 50 appointments a day every single day, which is an enormous effective increase in the availability of appointments.
The new repeat prescription service is now in effect, with explanatory leaflets available at the primary care centre main counter.